Shadow Health Secretary joins me. Wes, I hope you can hear me. Now, we've seen this announcement from Labour, 7,500 more doctors. I'm a bit confused because I remember you announcing this last year. You're going to pay for it with the abolishing of the non-dom status. But again, Rachel Reeves has been talking about that for 12 months. So, sorry, what's new about this Labour policy?
Well, I think you busted me, Camilla. It's a pretty shameless attempt to remind people that we've committed to the biggest expansion of NHS staff in history, funded by abolishing the non-dom tax status, because we think that people who make Britain their home should pay their taxes here. And the one thing I will say that's a surprise to me is that I'm still talking about doubling the number of medical school places, because I genuinely expected the Chancellor, Jeremy Hunt, to nick the policy, because he's previously praised it when he was chair of the Health Select Committee. He hasn't. The government have promised an NHS workforce plan. They haven't delivered one. And it's such a fundamental issue, because unless the NHS has the staff it needs, it's going to struggle to treat patients on time. And we're going to end up in this bizarre situation where on one hand we're turning away straight A-grade students from studying medicine at university, whilst recruiting people from overseas in greater numbers than we're training our own homegrown staff, which is not fair to other countries around the world. But even more importantly, it's not fair to bright teenagers in Britain who could be promising doctors and medics of the future who are being denied the opportunity.
How much does it cost to train a doctor?
Well, our package costs £1.6 billion in total, which includes doubling the number of medical school places. Medicine is an expensive course. That's why there is a cap on the number of medical school places. We don't think that cap goes far enough, and we use the modelling of the Royal College of Physicians to come up with our package, and it's one that's actually been welcomed by university vice-chancellors, the deans of university medical schools. Just the other day I was at Canterbury Christ Church University down in Medway. They told me they've got the capacity to expand medical school places, but they've not been given the opportunity. I was at Worcester University where they're saying, look, we're training students from overseas, but we can't train our own homegrown students. This is crazy.
Has it been welcomed by the BMA? Because I know the unions are worried about training more doctors because it might actually have the effect of suppressing wages.
I think, to be honest, that doctors and nurses and midwives know from working on understaffed shifts that they need the cavalry to come. They know it takes years to train doctors and nurses. That's why it's even more important to get going now. And similarly, you know, when I've talked about, as Labour is doing today, the fact we've got a postcode lottery in general practice, and that the ability of people to get a GP appointment and to get a face-to-face appointment in particular wildly varies depending on where people live. It's not really the fault of doctors. It is a reflection of the fact there are 2,000 fewer of them, and that the government isn't bringing in that pipeline of new doctors to come in and enter the profession as people retire. You know, there are some appalling stories I've been hearing from people who are losing GPs because they're retiring, and there are no GPs coming in to take over their practices. So we've got to deal with that pipeline of talent. And I know, but I think it's that long-term approach.
You can't do it without the unions on side.
Conservatives.
You told the Telegraph before Christmas, I'm not afraid to tell the BMA and other unions no. So can we please, because the People's panellists have asked this as well, you're the man who hopes to be the next Health Secretary, what percentage rise would you give to doctors and nurses, Wes?
Well, I'm not going to put a figure on it today in the way that if I were the actual Health Secretary, I wouldn't be negotiating live on air. I would get people around the table because it's a negotiation. And in fact, I was listening to Pat Cullen from the Royal College of Nursing this morning being interviewed. When she was asked, well, what is the figure you would settle on? She's not giving one. And I'm not surprised.
What's a reasonable figure,
that's the nature of negotiation. You go in and negotiate. The reasonable thing to do is to sit down and negotiate and get to a closer point, and that's the approach I will take as Health Secretary.
What sort of
because I do
ballpark?
recognise
They've asked for 35.
Yeah, and I don't mind saying that a 35% increase overnight is not something we would be able to afford. What I would want to do, as the last Labour government did, would be to get the economy growing, as Keir Starmer and Rachel Reeves have set out, so that we can invest in our public services and make sure that people are paid fairly. Because I've talked about recruiting new people into the NHS. We've also got to retain the people we have, and increasingly our pay rates in the NHS and in social care at different bands, different levels, are not competitive with the wider world, including the private sector.
All right.
So we see people walking out of the NHS into retail because they're paying better.
Well, you won't give me a straight answer on the percentage rise you'd like to see. Perhaps you could give me a straight answer on this one. Did Keir Starmer personally sign off those attack ads that have done perhaps some damage to your party?
I don't know at what point he was involved in the sign-off process, but I know that Keir fully supports them. He's been absolutely robust in saying that we are going to go after the Prime Minister for his record of failure. We've done it on crime, we've done it on the economy this week, and in the coming week we're going to do it again on the NHS. I think the Conservatives' record of failure is utterly appalling, and anyone who looks at those ads and feels offended on Rishi Sunak's behalf should be offended on the behalf of victims of crime, who's, like, you know, in the Kate and Rape cases, rapists don't even see the inside of a courtroom, let alone a prison cell. I think the Prime Minister should be held to account.
Hang on a minute here. Hang on a minute. First of all, there's some polling in the Observer today to suggest that Labour voters don't quite like these attack ads and don't think that they've worked. Second of all, Starmer's got some brass neck, hasn't he? He was the DPP in 2012 when Emily Thornberry complained about the fact that he had weakened rape prosecution guidelines. He's then on the Sentencing Council, which agreed that all paedophiles should not be put in prison. So why on earth is Keir Starmer in a position to lecture anyone on being tough on paedophiles and rapists?
Well, I think, to be fair to Keir Starmer, he had a proud record as the nation's leading prosecutor of trying to improve the prosecutions of people who are committing violence against women and girls. That was a priority that he set as Director of Public Prosecutions. But of course, whether we're talking about prosecutors or indeed judges,
why did Emily Thornberry complain about it then?
The wider criminal justice system.
What was Emily Thornberry complaining about?
I haven't seen it, but.
Well, she sent a letter accusing the DPP, who was Sir Keir Starmer.
I'm not being difficult.
No, but hang on, Wes, we've got this in black. OK, so Emily. OK, let me explain it then. It's really simple. Emily Thornberry wrote to the DPP, who was Keir Starmer, in 2012 and said, "You're weakening rape prosecution guidelines. Stop doing it." So he wasn't strengthening rape prosecutions, he was weakening them. He was on the Sentencing Council, which agreed that not all paedophiles should be jailed. So he weakened the sentencing of paedophiles. So what on earth is he doing, signing off attack ads? It's hypocritical, isn't it?
No, I think what Keir Starmer is rightly doing is accepting that, as politicians, Parliament and government has a responsibility for making sure we've got an effective criminal justice system that is on the side of victims and brings perpetrators to justice. And after 13 years of failure, it is an abysmal failure where I think 1% of rape cases are prosecuted. That means if you are a rapist in this country, you are not even seeing the inside of a courtroom, let alone the inside of a prison cell. And I don't think it's
all right, talking
wrong at all
about
for the Labour Party
victims,
to be robust in challenging the government.
Talking about victims, finally, Wes, will Labour apologise for introducing smart motorways in 2006?
On smart motorways, you've got to follow the evidence ultimately, and make sure that we've got a system that works in the interests of the safety of the travelling public and passengers.
Was it a mistake?
I think we've been pressing the government on the smart. We've been pressing the government on this, so I'm glad that the government seems to have reached a conclusion on it.
All right, Wes Streeting, thank you very much indeed for joining me this morning.